very burning questions that we really have to go through it. I can see Professor Victor Hugo ready to speak while he is preparing and starting to share his desktop. I'll briefly introduce him. Professor Victor Hugo Perez is from Mexico. He's a master neurosurgeon, anatomist, and also expert in forensic and medical legal affairs. Today he'll be talking to us about often neglected, yet a very important part of neurosurgical anatomy, which is venous anatomy. And I can see his presentation loaded, and I will mute and let Professor Hugo.
Thank you to all of you. Ahmad and Vlad, I am very happy to be in this important course. Let's start with venous anatomy. I took some text of Albert Rotten to explain the fantastic venous anatomy. Frequent variations in the size and connections of these veins have made it difficult to define a normal pattern. And the nomenclature used to describe the veins has infrequently been applicable to the operative situation. The fact that sacrifice of the major trunks of the deep venous system only infrequently leads to venous infarction with mass effect and neurological deficit is attributed to the diffuse anastomosis between the veins. But I think anatomy of the veins, of the cerebral veins, has not been described as well as we can see in the exercise of doing dissection and injection of cerebral veins. This is the lateral aspect. This is the frontal view of the brain stem. And of course, in here we can see very good anastomosis between the veins in front of the brain stem, the midbrain, the pons, and the oblongate medulla. So this image is really beautiful because you can see the rich anastomosis between these veins. The cerebral veins may pose a major obstacle to operative approach to deep-seated lesions, especially in the pineal region, in this part of the brain, under the temporal bone, and the part of the superior sagittal sinus. This is the superior sagittal sinus, and these are anastomotic in the lateral aspect of the brain. So I want to show you this video. Okay. Here I am doing a dissection of the arachnoid membrane. As you can see, we need to make a careful dissection of the sagittal sinus and the veins that drain into this important structure. So, of course, this is a model, this is a specimen, a brain, but the same care we need to take in order to avoid damage these important veins. These are known also as bridging veins. Especially in dissection of tumors like meningiomas in the sagittal, superior sagittal sinus. You can look also some arteries that are coming from anterior cerebral artery. So this is a great meningio. When you need to dissect this lesion, this tumor, we need to take care to preserve these the veins that go into the sagittal sinus. So the superficial veins are distributed in four groups. The first group is the superior sagittal, and this is composed of the veins that drain into the superior sagittal sinus. This is another injection, another brain. We can see here the posterior part and anterior part of the sagittal sinus. And this is and these are some veins draining into the superior sagittal sinus. This extension of veins are known as Venous lacunae. The other group is sphenoidal. The sphenoidal group is formed by the bridging veins that empty into the sinuses that course on the inner surface of the sphenoid bone, formed by the terminal ends of the superficial sylvian, and occasionally the deep sylvian veins drains a part of the frontal, temporal, and parietal lobes adjoining the sylvian fissure. The tentorial group of bridging veins drains into the sinuses, coursing in the tentorium, or into the transverse and superior petrosal sinuses in the tentorial margins. The group is composed of the veins draining the lateral surface of the temporal lobe. This is temporal lobe and occipital lobes. This group includes the temporobasal and occipitobasal veins and the descending veins, including the vein of Lavet from the lateral surface of the temporal lobe. This is another video. In this, I want to show you the lateral aspect of this brain and the rich anastomosis of this group of veins. This is the sylvian vein, also known as superficial middle cerebral brain. This is the vein of Lavet and vein of Trollard. As you can see, we have a rich anastomosis in this lateral aspect of the brain. But we have variations in the venous drainage. Sometimes we could have only a good vein of Lavet, but it doesn't have good anastomosis with sylvian and also the vein of Trollard. In this lateral aspect of the brain, we can see the vein of Trollard. the frontoparietal vein, this great anastomotic vein. And in here we have the vein of Lavey. So this is a small anastomosis of this vein. Here we have this frontal vein going to the Sylvian vein, and this is the vein of Lavey and the transverse sinus. This is anterior temporal vein. The Falcine group is formed by the veins that empty into the inferior sagittal or straight sinus, either directly or through the internal cerebral, basal, and great veins. This is the Falcine group. These veins go to the inferior sagittal sinus. The dural sinuses into which the cortical veins empty are the superior and inferior sagittal, straight, transverse, tentorial, cavernous, sphenoparietal, sphenobasal, and sphenopetrosal sinuses. These sinuses form the terminal part of the superficial cortical venous system. This is a dissection of a brain where we can see the superior longitudinal sinus, the transverse sinus. Here we have the straight sinus, and this is the skull base in its endocranial view. Here we have the confluence of the transverse sinus and the superior longitudinal sinus. Here we have the sigmoid sinus, superior petrosal sinus, inferior petrosal sinus, and cavernous sinus in this part. In this picture, we can see the cellar region, cavernous sinus, the left, the right, and the intercavernous sinus. So doing dissection of these models, we understand much better the anatomy of the venous system. Here we have the straight sinus that go posteriorly to enter to the confluence of these veins, the superior sagittal sinus and transverse sinus. If we advance for dissection, we have two major distributors into the great vein, also known as vein of Galeno or Galenos vein. These are the internal cerebral veins associated with thalamus and the plexus choroides. They travel posteriorly to join this Galenos vein. And the other distributors are basal veins, also known as Rosenthal basal veins. Another view with the superior longitudinal sinus and the transverse sinus. Here we have occipital vein. As I told you, in the brainstem, we have a very good anastomotic veins. So also in the lateral aspect, so here we have the vein of Lavey, this one. In this brain, I did resection of the gray substance of temporal lobe. And in here we can see the straight sinus, the sigmoid sinus, and where do the vein of Lavey is located. So this is almost 1 centimeter posterior to the junction of a straight sinus and sigmoid sinus. Almost 1 centimeter posterior to this junction, we localize this important vein, the vein of Lavey. And here we have also the middle cerebral artery in first segment, the second, third, and fourth, the cortical arteries, the branches of this middle cerebral artery. The endocranial view of a skull base. If I am doing also some models for residents, especially the in these models made in the scale 1/1, also the skull, not the cranial nerves. In these models, we can see in an schematic view the sigmoid sinus, the superior petrosal sinus, inferior petrosal sinus, clival sinus, and in this part we have the cavernous sinus. These models are made to understand the anatomy of this important region. Here we have the middle fossa, posterior fossa, and here we have some venous affluence to the superior petrosal sinus. The cavernous sinus, anterior clinoidal optic nerve, supraclinous carotid artery, third cranial nerve, fourth, fifth, and the other cranial nerves. So what I want you to see is the venous drainage of in this middle fossa. You can see in here in this brain we do not have a good vein of Lavey. Instead, we have some venous affluents in the inferior part that are coming from the inferior part of the temporal lobe, like this. This is really, really an interesting feature of venous drainage, because if you are going to make, for example, an anterior petrosal or presigmoid approach to the petrosal region, you need to be very, very careful because we can damage these veins, and we could have a disaster in the postoperatory or the transoperatory procedure, surgical procedure. In this part of the posterior clivus, we can see the clival sinus. I showed you this picture. This is really nice for the comprehension of the venous system, the deep venous system and the sinus. And this is another model. This is the straight sinus, and the two major distributors to the great cerebral vein, also known as Galeno, vein of Galeno or Galenos vein. These are the Rosenthal basal veins and the internal cerebral veins. This is another picture of the posterior aspect of the brain, and some occipital veins, the straight sinus, and the venous confluence. In this venous angiogram, we can see variation of the sinus. So we have a hyperplastic transverse sinus, and also the sigmoid sinus. But we have also an anastomotic sinus that is the occipital sinus. In the other side, we do not have a good transverse sinus. So in the preoperative procedure for some petropelvic lesion, we need to know the state of the venous system in order to avoid a lesion to these important veins. So this model, this is only an example that we should need a very basal approach in order to see the neural and vascular components of the cranial base. If we do not make a good approach, it's difficult to see these important structures. And in that case, we should retract the temporal lobe and could damage the brain. So if we, like in this case, if we make a very basal approach, we are going to see with less retraction of the temporal lobe these nerves. Here we have the fifth cranial nerve, third, fourth, and fifth. Inside the cavernous sinus, the 6 cranial nerves. So this is a model made with silicone and resin. The resin is in scale 1:1 to a real one. So this is another variation in the venous drainage. You can identify very well the variation. This is a hyperplastic transverse sinus. This is a hypoplastic transverse sinus. This is a superior sagittal sinus, the venous lacunae, and this anastomotic vein that goes into the superior sagittal sinus. So the other cranial base sinus is, of course, the cavernous. So here we can see the venous cavernous sinus. So this is the intracavernous carotid artery, and here we have the 6th cranial nerve. I made this dissection to understand the anatomy of the cavernous sinus. Here we have the meningohypophyseal trunk, the tentorial, also known as venas conica cinerea. This could be the dorsal meningeal artery, and this one could be also inferior hypophyseal artery. Here we have the lateral artery of the intracavernous carotid artery. Optic nerve. This is a view of the clivus. So look, this is really nice to make this kind of dissection to understand this venous drainage of the brain. The intercavernous sinus, anterior, posterior intercavernous sinus, the right cavernous sinus, third cranial nerve, in the right side, left side, and the 4th cranial nerve and 5th cranial nerve. Another view of the superior aspect of the brain. In this, you can see this venous lacuna. This is very important when you want to dissect or when you need to dissect some tumors. You need to keep in mind that this venous lacuna can be misinterpreted as sagittal sinus. They are also, these are an extension of the superior sagittal sinus. Here we have another view of the superior aspect of this brain. Here we have this inferior petrosal sinus. So in order to understand the brain, not only arteries and veins, but the different components of the deep structures of the brain, is important to make a dissection, to make cuts, to stain sometimes this brain. And if you do this kind of dissection, we can understand much better anatomy of the brain. Now with COVID disease, I think it's going to be more difficult to make dissections because we do not know in patients with that died have or not have COVID disease. So, but I think we can do with some care the dissection. Continue with this exercise because it's very important. This is superior aspect of midbrain. In here we can see the basilar artery, its bifurcation in posterior cerebral arteries, and this is the superior cerebellar artery, in this case, in the other cases. So thanks, greetings from Mexico. Hope we could organize the Congress next year. It depends of advance of COVID disease, but best wishes to all of you, and thank you for listening me. This is end.
Perez, thank you very much for beautiful lecture showing us lots of beautiful dissections. While the next speaker is getting ready, we have time to, excuse me, answer perhaps one question coming from Radames Ramirez Cano. What advice would you give for dissecting complex venous structures in the Sylvian fissure? I presume the question is about, do you have any tips on opening Sylvian fissure, particularly when there are lots of juicy veins in there? Victor, can you hear me?
Yes.
Yeah. Just I wonder whether the question was clear. I suppose the question is whether you have any personal tips on opening the Sylvian fissure, particularly thinking of the venous structures.
Excuse me again?
There's been a question whether you have any tips.
Okay.
On opening the Sylvian fissure.
Okay, so if you inject the venous system and also the arteries, of course, the brain needs to be prepared with formalin, And you should use micro scissors to open the sylvian vein, but specifically, you are going to make a good dissection if you inject previously the brain, all veins and also arteries. So I think is the most important to understand sylvian fissure.
I suppose for the patients that are not in formalin yet, the way to do it is to mostly stay frontally and take your time and try to understand which veins belong to the temporal lobe, which veins belong to the frontal lobe. There might be some small anastomosis and just remain clean, not much retraction. And that's supposed to be kind of my tip for that. Well, I'm glad we managed to go through the venous system because of lots of catastrophes that we see post-surgery are often attributed to fate or things like that. But often the cause is venous. So the more we understand, the more we respect, the more we view veins before surgery, the less surprises we will get at the end, even in the few post-operative days. Now, it's a true pleasure introducing Ramez Quirolos, Professor Quirolos from National Neurosciences excuse me, Institute in Singapore. Ramez and I started pretty much at the same time in Cambridge, me as a trainee, him as a consultant, and it's been a fantastic journey of friendship since. I've learned a great deal, and I have to say, even as a junior trainee, when operating on Ramez's AVMs, I thought I could do anything, and somehow it just looked all so simple. And it is because of understanding of AVMs. And I'm delighted to introduce Ramez to you, and specifically his talk